what we say a lot of the time is we don't make money off of your reproductive decisions. And we truly do that. We put that into practice. It's very genuine and it's very authentic type of healthcare that's very lost out in a very busy city, a very expensive city like Seattle, where there's constant transactions, there's constant how do I bill correctly in this appointment to exhaust that revenue for that major hospital.
Welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, APLOG. On this podcast, we bring on experts to provide insights to support medical professionals in their life-affirming practice and career. I'm Dr. Susan Bain, and I'm excited to be your host for today's episode. Some of you might know that I serve as the medical director of 4 pregnancy centers in my home state of North Carolina. These 4 clinics are committed to providing high-quality medical care, as well as emotional and material support for pregnant women. I'm passionate about expanding the availability of robust, life-affirming healthcare services in our country. That's why I'm proud to be speaking to our guests today, who are currently doing exemplary work running a life-affirming women's clinic in Seattle, Washington. 3W Medical for Women is a Seattle, Washington-based healthcare clinic whose mission is to provide compassionate, holistic, evidence-based health services and education to make informed healthcare decisions. 3W Medical is helping to reach the most vulnerable, at-risk women by providing real health care without abortion and contraception. 3W has assisted women in reclaiming control of their bodies through evidence-based body literacy education. The clinic won the 2023 popular vote for Best Women's Clinic in the Pacific Northwest. Today, I'm speaking with Dr. Susan Rutherford, the medical director of 3W, as well as Helen Nguyen, the clinic's CEO. Ladies, thank you for joining APLOG today.
Thank you for having us.
Thank you so much.
So the first question is, I just want to hear from both of you. Share with our audience how you came to do the work that you're doing right now. And congrats on that award.
Thank you so much. Yeah, you mentioned the 2023 award. We also won it this year.
Oh, you go. Woo! That's awesome.
Like a week ago. Yeah, like a week ago. We finally are able to announce it. So
yay. So you are repeat winners. That's fantastic. So we definitely have an exemplary clinic to talk to. So let's go for it. So how did you tell us about your work there?
Yeah. Well, you go first.
I was going to say, the story really starts with Helen. She and another university student, Helen was working on her master's of social work and was friends with an undergrad. And they started thinking about the need in this area because there had been no life-affirming clinic type services or pregnancy centers or anything like that since 2010 in Seattle. And they got encouragement from some leadership, including some business people. And so they were planning this for about a year. And somebody said, Sue, you'd better, I think you'd be interested in this. And I said, I don't have time. So they did that for about a year. And then I got a call and said, well, we've been thinking about it and we decided we'd like to do a women's clinic. And I said, oh, when's your next board meeting? Tomorrow.
That's kind of how we roll.
Yeah. So it's been since then that I've been involved, and it's been a real privilege. But it was really Helen and her friend Melanie that are the founders.
Oh, thank you, Sue. Well, we couldn't never get it to this point, of professionalism or healthcare standards without Dr. Rutherford's involvement. Like, she brings the experience, she brings the credibility. It was just kind of like a very mom and pop feeling when we first started, and you kind of accelerated it to the level that it is now. No. Yeah.
Yeah. And Dr. Rutherford, your background, I was on the website and wow, what a great place it is just to learn about what you're doing. You're an OBGYN and a maternal fetal medicine specialist, right?
Yes, and I'm now retired. I actually joke about being retired from the paycheck.
Okay,
I basically
gotcha.
retired to do this work with the clinic,
Yeah.
as a
Okay,
volunteer.
Mhm.
gotcha,
You should.
gotcha. So,
Yeah.
sorry, were you going to say something?
Oh, I was gonna say she was in the Navy. She plays the violin. Like she's amazing. She jumps out of helicopters.
No, I don't.
Well, I can only
Yeah.
imagine how much your patients love you. So,
Yes.
when we think about pregnancy centers, there are about 2,700 across the country. In my state of North Carolina, we actually have 97 in our 100 counties. So many of our counties have pregnancy centers.
Wow.
How for our audience, how do you categorize yourself? The classic pregnancy resource center, or a pregnancy center with a medical clinic in it, or a women's health clinic? How do you describe yourselves?
Yeah, I would describe ourselves as a women's medical clinic that does not provide elective services such as abortion and contraception.
Okay.
And yeah, and so if folks come to our clinic, we look very medical because we are, right? We have licensed healthcare professionals. They're the only ones that are interacting with patients on a daily basis when we do see patients. I, as a social worker, am not doing that unless completely necessary. But it's folks like Dr. Rutherford, it's our PA, it's our naturopath, it's our medical assistants that are the ones facing our patients
Yeah.
and serving our patients.
And we've had 2 nurse practitioners also. So
Yeah.
we're looking for more clinical help in
Yes.
case anybody hears this and wants to be in Seattle.
Yes. We're mission territory.
I actually know somebody who's finishing residency and heading that way. We may have to talk.
Okay,
Yes, definitely.
please. Yes, yeah. So we're also an accredited clinic, which then puts us in a different category as well. Did you want to talk more about
Yeah,
Sure.
I was going to ask actually about that because, we're often branded as fake clinics.
Yes.
And that is a brand that is unfair. In the 4 clinics that I actually work in, I'm a board certified OBGYN and I see patients. I have an RN that sees patients, ultrasonographers who do our ultrasounds. And so I love the idea that you have gone the extra step also to have the accreditation process. So tell our audience about what that means for you, maybe what the process was about.
Yes, we've now been accredited twice. It happens every 3 years. It's almost identical to what hospitals go through, like with the Joint Commission. There's a slightly less expensive approach with the Accreditation Association for Ambulatory Healthcare. So that's the one we use. But the policies and procedures, one of our board members is a pediatrician who was very involved in some leadership in a major healthcare organization. And he says, man, these policies, they're better than some hospitals. So it's a lot of work, but it definitely does 2 things. One is it ups our game because we learn from going through that work. Second thing is
Absolutely.
and it protects us. So when we invite people to join our team and they know that they're on an accredited team, then they feel more like their license and their professional reputation are protected. In this state, how many sort of clinics in this whole spectrum might there be? About
There's 8 of us. That includes us.
that includes us that are accredited in this state. But there are other clinics that are, not doing the medical. And if all of those clinics combined, is there, how many would you say?
Across the state?
Across the state? Roughly 50, is it?
No, less than that.
Less than that.
Yeah,
Okay.
I want to say in the 20s.
In the 20s.
For our state.
Compared to what you described in North Carolina. And our leading candidate for governor has pledged to eliminate all pregnancy resource centers or crisis pregnancy centers or whatever you want to call them once he's elected. He's currently Attorney General. And so we did it for defense, but also we want to reach women who take their healthcare seriously, or who need a lot of education about their bodies. And we want them to feel like we're a trusted place for them to come, regardless of their worldview. And so we've got full schedule, and we're reaching a population that has no history and probably wouldn't darken the door of what's called a pregnancy resource center. So we're reaching people to get them good evidence-based medical information, and at the same time really show love to them. So combining those two things is really what we're all about.
I love that. So tell the audience a little bit more about the medical services you provide. I, looking at the website, was able to learn about the health screenings, education literacy work, STI testing.
Yes.
A lot of the pregnancy centers are looking to expand services and would love kind of the process that you did that. Did you do it all at once, or did you add things on over the years, and what impact do the various pieces of the puzzle for women's health, how's that matter to
Well,
your patients?
yeah. Well, we started with the premise that we were going to do virtually all those services. We still have a list of things we'd like to do we haven't gotten to yet.
Yeah.
Okay.
Yeah.
But
Slowly.
yeah, but especially the women's health screenings,
Mm-hmm.
the pap smears, and but we deal with minor GYN problems as well, like vaginitis or urinary tract infections, or people come in with, I have a bump here, or can you look at this rash, things like that. We are trying to stay away from primary care, though many of our clinicians have family medicine backgrounds and they can address a few of those things. But our desire is not to provide ongoing primary care or anything like that, but to help people get started so that they then can get referred to, encounter the rest of the medical system, and get engaged and get committed to their long-term care. So I'd say the GYN women's health screening is a big piece of what we do, maybe 40% or so. And then the STD testing, which is kind of overlaps with that. The STD testing kind of overlaps with that. And we even will do STD tests on men if they come in, because that certainly affects women's health. And we don't get a lot of men, but at one point we had a bit of a trend.
Mm-hmm.
So it's interesting because the education fits into all of that. How often should you have pap smears, or, cervical cancer screening? How often should you get STD tests done? What are these things about? And one of the things I've found is that when you present to patients, we ask them to pay the lab cost for the tests, and it's very inexpensive. Um, chlamydia, gonorrhea is under $20 to have
Okay.
that test. Pap smear is under $20. And so to have them look at those options, oh, shall I have the herpes blood test, or shall I check my hepatitis B or C? They can make those decisions. You educate them. Patients are really good. It speaks to the rest of our healthcare system, where there's so much knee-jerk stuff. This has really actually been a pleasure to interact with patients and have them truly involved in their healthcare decisions. So those are two big pieces of what we do. And the third is pregnancy verification. We can do a very limited amount of prenatal care up until 20 weeks, but as you know, as an OBGYN, there's not much. We don't get into the detailed anatomy screening of the fetus. We don't have the liability insurance to go beyond the very basic stuff. But
Right.
women cannot get in to clinicians. It takes them 6 to 8 weeks to get an OBGYN appointment once they figure out they're pregnant. Well, how far
Right.
along they are, nobody knows. And as you probably remember and know, a good half of women really don't know how far along they are, or if they think they're a certain gestational age,
Right.
they're off. So
Yeah.
this helps women, and regardless of what their pregnancy decision is in terms of whether it's life affirming or not, we're still going to give them that information because every chance we have to show them that we love them and give them the options that enable them to make a decision that they really want to make is a golden opportunity.
Yeah.
Yeah.
It sounds like you're really filling in some gaps.
Yes.
Access to care is important.
Mhm.
And you've recognized, whether that's the physical or the first trimester, early second trimester prenatal care, those gaps are really needed. So
Yes.
when you are thinking about the fact that you're a two-time award winner as Best Women's Clinic in the Pacific Northwest, I'm curious, what do you think it is about what you do or the way you do it that leads people to vote you to win that award?
Mhm. Um, I think out here in the Pacific Northwest, places like Planned Parenthood is very loved and trusted. And they were on the list of folks that we beat out, by the way. But the thing, I think the thing that we do really, really well is that we actually put into practice the care that places like an abortion facility, like places like Planned Parenthood can't do. They see that individual as a transaction, as someone that they can
Make money off of.
make money off of, right? Essentially, right? How do they affirm this promiscuous lifestyle in this individual so that they can then play the long game of her coming back and potentially having an unplanned pregnancy? And that's what drives that incentive for that type of care. Well, when they come here, we don't have that incentive. A lot what we say a lot of the time is we don't make money off of your reproductive decisions. And we truly do that. We put that into practice. It's very genuine and it's very authentic type of healthcare that's very lost out in a very busy city, a very expensive city like Seattle, where there's constant transactions, there's constant how do I bill correctly in this appointment to exhaust that revenue for that major hospital or something like that, right? And that's a whole other can of worms of where healthcare is going. We have the luxury of really meeting that woman at the well, really engaging with her and engaging in a conversation that is life altering and life changing. And I think that that one-on-one time, that unrushed care, that we don't have any skin in the game if you choose this or that, really empowers our patients and gives them the freedom to really embrace their God-given their God-given dignity over their own bodies. And they walk away going, wow, I just got the education. I was given compassionate care to then know where to navigate next in my life. Most of our patients sometimes they just need someone to talk to. No one is listening to them. Your typical medical appointment out here in Seattle is 10 to 15 minutes, and the clinician most of the time is looking at a laptop. They're not even looking at the patient. So I think we've done a very good job of eliminating the scariness, the barriers that some of our patients encounter with the healthcare system sometimes, and built relationships that causes them to pause and say, is this really who I want to be intimate with? Is this really who I want to share this very special part of me with?
Mhm.
And slowly that's kind of where um, clinics like ours, and I encourage, and going back to your original question of, more clinics are seeing there's this push and there's this need to expand services beyond pregnancy. And I wholeheartedly cannot agree with that enough. There is room for us to grow into that and reclaim what women's healthcare truly looks like, and really take back grounds from places like abortion facilities that encourage a lifestyle that leads them down, very dark consequences. Um, so yeah, I think our patients recognize a good thing when they see it. So,
Well, I would definitely vote for you after hearing that. um, it sounds like from listening to you, you're accompanying patients. Dr. Warren Kinghorn was one of my faculty members when I was at Duke Divinity School in their theology, medicine, and culture program. And he talked about how we journey with our patients from God back to God. And just the beauty that we're not really providers, we're not technicians of services. Rather, we're professionals that are on this journey together. I walk in a room and I don't hang who I am at the door, and I bring medical expertise, but they bring the expertise of their lived experience and being in their bodies and knowing their bodies. And it sounds like you give them the space to explore that, which doesn't happen often in our healthcare system. And I think I saw that your average patient visit is about an hour, and
yes.
I love that about what you do. Now, the fact that you're based in Seattle, and you mentioned, when you were talking about that, Helen, it's a unique city, and some of the challenges you have. So, when you think about the values that lead you to do the work the way you do, are you challenged much in the environment you're in, or have you gained that trust from the community that it's easy to stay true to who you are at this point?
Yeah, I think the work that we do is never going to not be a challenge. Seattle's known to be a pretty dark space in our nation. Just we're in the news constantly for not very pretty things.
Mm-hmm.
Just to give our listeners a landscape, we're located just blocks away from the University of Washington, 50,000 students. It's the largest campus. And in a 20-mile radius of our space are 7 abortion clinics. We're the only ones in all of
Wow.
Seattle that's providing something different, that is providing actual healthcare to women that, everything that I talked about. So it can get very dark, and even our Board of Health, our King County Board of Health, has tried to come after us. The campus won't let us,
Yeah, we
come
got
on.
voted off campus by the student senate.
Yeah,
Oh,
even when we've
hey.
positioned ourselves and marketed and brand ourselves very savvy to look not like a traditional pregnancy medical clinic.
Mm-hmm.
So just the fact that we don't provide abortion, just the fact that we don't provide what they consider as healthcare, deems we are the enemy.
Mm-hmm.
And we try to work really, really hard in saying, just because we don't provide that service doesn't mean we don't educate you about abortion, right? We're
Right.
all informed consent, right?
Yes.
Mm-hmm.
We're all about educating you. We're all about equipping that young woman who has an abortion 2 days from now. What are the questions that you should be asking yourself? Do you know what that procedure looks like? Not in a not in a scary
Right.
way, but you get all this information when you have hip surgery, or any type of other surgery. Why are you not getting informed consent in this very invasive and life altering medical service? So that's kind of the questions and an approach that we have with our patients is, what do you really know and what do you deserve to know? And how do you advocate for yourself as a patient if you decide that's where you want to go next? So yes, we have gotten pushback, but when our patients come in, we don't spend a lot on marketing because word of mouth is the marketing, right? Women trust women with their healthcare. And so when they encounter an experience with us, they're like, "Oh, that's interesting. I had a great time. Dr. Rutherford was amazing. She took the time. She educated me. She was funny. She was like, all of those things. I don't know what other people are talking about. I'm going to send my girlfriend here."
Yeah.
So even though we've gotten heat from all types of sources,
And bad press.
and we've been in the news, we've been in the newspaper and all this stuff, they have not been able to shut us down or fully like
They haven't been able to neutralize the work we're doing.
Yeah, because they can't deny it's good services. They can't deny
Yeah.
it's good medical care.
No,
They can't
exactly.
Yeah, they can't deny Dr. Rutherford's years of experience and knowing what she's talking about when she's encountering a patient. So I don't know. Uh, Controversy comes with the game, so we kind of
Yeah,
embrace it.
there you go. I love it.
Yes.
Well, you know, the message I'm hearing is so consistent with APLOG's work. We believe we should empower women with information, and women and their children deserve exceptional health care. And that's exactly what I think our audience has heard from you. And I am just so appreciative that you all took the time to talk to us today. Tell us, where can people go to learn more about you?
You can go to our website, 3wmedical.org. So that's a number 3, letter W, the word medical.org. All of our information is on there. I'm sure if you wanted to talk more about our accreditation process, Sue is Dr. Rutherford is a wealth of knowledge in that. We
Well, we have a whole team.
Yes, we do have a whole team. It's not just us.
Yeah.
Yeah. But we're happy to talk to any clinic out there that's thinking of expanding services, how we've done it. We're happy to share any of that information. And
Yeah, it's really exciting to hear about clinics. I know of one in Oregon. I know of several in Georgia. There's Illinois, I think even. But so there are people where we've had conversations that are around the country that are starting to get this idea. And I think there are two good things. One is the medical excellence. The second thing is much of the population, or many of the women that we're trying to communicate with and reach, are totally on a different page as far as their history, their life history with their parents, their knowledge of ethics as they're growing up, which includes their religious or lack thereof education. People just aren't speaking the same language as they did when I was growing up. And so just making it accessible for women to see that there's a different way of talking about all these important life issues is, I think, part of what's really being accomplished by this shift.
Well, I love it. And thank you for being leaders in the shift because, as I think, Helen, you said, I love the concept of women trust women with their health care. And so clinics can trust clinics with their health care. And so hopefully today they've learned about your clinic and a great example that I think. Uh, as a medical director of a pregnancy center that's getting ready to head there for an evening clinic not too long, I am going to be thinking all about this and how we can expand our services to address our community's needs. So thank you so much for being here today.
Oh, thank you.
Yes, thank you very much for helping
You're
get the word out.
exactly. So to our audience, thank you for being with us. And if you like this episode, be sure to give us a like and subscribe on our YouTube channel. If you're listening with a podcast app, feel free to give us a 5-star review, and we will see you on our next episode.